ultimately we ended up with about 46.
46, yeah.
6 to the bone, 40 to the prostate. That's a lot of treatment. It's a lot of radiation. That zaps a lot of your strength if you're not working out. Fellas, I'm gonna say this really important. You have got to work out while this is going on.
And doctor said about a month after the radiation treatment, any side effects, that's where you really should start feeling better.
Right. So I got a month before I feel better.
Right.
Right? Ain't that a trip? A month.
Or any kind of post like issues, like you may feel something the rest of this week or next week,
right,
from your radiation to the bone, but in about that month's time it should go away. It should subside.
So it should subside. But you know, we sound like we the doctor. We gonna wait till we know we've been doing so much homework.
Yeah.
You know, she's a researcher by nature.
The modern age.
Yeah, I'm a researcher.
Of technology. Yeah.
Yeah, and then we don't mean just Google what you want to see. You know, really go through. We went through actual medical studies and studied those things. Okay, don't just Google stuff that you want to see.
Right.
You know, and as odd as it may seem, I'm thankful. You know, 'cause I've seen some people walk through here that were really struggling to just walk through here to get treatment. You know.
So if I was sitting in the waiting room, I've gotten to know quite a few people and have conversations.
One guy from Delaware, remember?
Yeah.
There's another guy from Delaware. Man, shout out to you, brother. You know, we got to hang out one time. We got to find him.
Mm-hmm.
Yeah, he's from Delaware.
Mr. Harris.
Mr. Harris, yeah. He was inspirational.
Yes.
Yeah, he was inspirational. He don't even know how inspirational he was.
I mean, people are bad at throat cancer, tongue cancer, where they can't eat,
can't talk.
I mean,
getting radiation all in their faces and their tongues and their jaws and their eyes. And, you know, not that my radiation where I am didn't affect me too.
Right, but you know, it's like,
yeah, but it's just, you know, no matter what, you know, things can always be tougher.
mm-hmm.
So I'm thankful for where I am, where I'm at. You know, because I started getting a little scared, actually, towards the end of the thing. I'm like, dang, I'm doing all this radiation in my body.
It hit you.
Then it started hitting me, you know. We was at 30-something, 40-something. But by that time, it's over with, you know.
That's a lot.
That's a lot.
All right. Just wanted to talk to you about your lab work and treatment.
All right.
Dr. Saul will pretty much talk to you
No
about
problem.
the rest. So pretty much your PSA is 0.7.
Right.
So
I saw that in the thing.
It's pretty good.
Pretty good?
It's really good, actually.
Oh, great. Good. Because I know it could be like as though it's 4 and be okay, but okay. All right, cool.
The thing is, we want to see a lower. For us, technically, our lab just will tell us less than 0.1 is what we consider undetectable. Mm-hmm. So in about 6 months, that's where I really predict you're going to be. Like, I have no concern for you at this time with your end of treatment PSA being like that.
Cool.
Like I said, I think I told you, the one that we got the end of treatment is not the one that we're most focused on. This is just to kind of create a new baseline for you, just to see like this, hey, this is what you were at towards the end of treatment. Because you still have one more, the last one on Monday.
On Monday, right.
Correct. And then the effects of radiation prolong for months at a time. So at your 6-month follow-up, I really think your PSA is going to be undetectable.
Cool.
Wow.
Congratulations for completing your radiation.
Exactly.
Lifestyle suggestions.
One more left. You got one
more left.
I understand it's been a long road coming. I know you guys come from far, so.
Restrict red meat consumption. You ain't got to worry about that from me.
Yeah.
That one, the only one I've actually seen Dr. Song ever really like kind of put emphasis on is the pork. For, like per research, pork tends to have more carcinogens.
Wow, more than even regular meats.
So that's just one that we tell patients to we're not telling you to eliminate.
We're vegan.
We're vegan here. I'm hopefully plant-based. In fact, I'm going more raw.
Okay, there.
Vegan.
So this
you
is
guys
good.
don't have to worry about
I was going to say this.
Because everything else really is just eat a lot of vegetables, fruits. Most important thing, keep yourself active. You gotta remain active, especially because you're going to be taking.
Oh man.
You're going to feel the hot flashes, fatigue. So it's important just to keep yourself active.
When you have
sleep.
Sleep enemas.
I used it a couple of times earlier.
Have you been using any other laxatives or
no?
Nothing like that. No Miralax.
No.
All right. This part you can disregard. This specifically talks about if you're taking Miralax or if you're taking.
Oh, how to get off of it gradually.
Yeah.
Okay.
Because sometimes if you just abruptly stop it, it causes reverse constipation.
Oh,
So there's like a specific taper only if you're taking Miralax, but if you're not doing that,
Yeah, he-
disregard that.
Well, that might be where we're eating the whole food plant-based thing comes into play, because I really didn't have any.
he didn't
I didn't have any problems
I
with
think
it.
so. I think that's really why you bowel
Just
movements are good.
bowel movements have stayed the
I don't
same.
think this was necessary for you while you weren't treated.
No, it was not.
Oh, right here with the sexual, the semen and the blood. What's that?
That's
This
the
is
other
called-
thing. So with radiation to the prostate,
Mm-hmm.
this is a very common, and it's not urgent or anything concerning. It's
Okay.
a common and expected thing
Like after it stops.
after radiation. So this
After-
typically will not happen usually from my experience.
Mm-hmm.
It doesn't happen for months or like up to a year post radiation.
Okay.
You may notice some blood in your semen if you're
Like a year later, or
Correct.
oh
Up to a
wow,
year.
like a year.
Okay.
It's not usually
Up to a year later, or in a year.
in a year later. Usually, it doesn't happen
Oh.
immediately after.
Okay.
Usually, the patients who are coming in or like calling in,
Okay.
these are typically happen like a year after radiation. So if this happens, it's nothing to be concerned about. Okay.
Okay. It was kind of like the same thing that happened when I had my biopsy.
Correct.
Okay.
If you do have some urine in your blood or stool, again, that's something that we would want you to contact us for, but it's not something like that you need to go to the emergency department.
Okay. One thing I can tell you this: I'm so tired of coming to this hospital. That gets old real quick. Every day you're reminded that you're sick. When you come in there, you know. You know what I want to do? I want us to go back on the beach. Remember when we would go on the beach and take pictures and do all kind of posts with our, with our fitness stuff and all of that. You know, I want to go back to being normal, but not the same. Always better, but I guess this is 3 months.
So congratulations. And your testosterone is, in the zone where we want it to be.
Okay.
Your PSA has come down significantly. I'd like to repeat it in 3 months. So the way the Orgovix works is it keeps the testicles from creating testosterone. The Xtandi blocks the cells from seeing testosterone, and it essentially blocks the receptor, the signal on the cell. It's sort of like a receiver, and it receives the signal from the testosterone, and it blocks that.
So actually, the second medicine doesn't necessarily depress my testosterone levels lower. It just disconnects the cells. That's all it really does.
Generally, I like to see it go down to less than 0.5.
Okay.
I think in 6 months we'll probably get there.
Okay, because we're at 0.7 now.
Correct.
So we do it in 3 months and then again
Doing
in
it 3
6
months and then 6 months. Okay.
With prostate cancer, because it's slow growing, and because it can kind of be dormant for a while, it's a long time before we can say it's cured.
Okay.
I usually wait until 10 years.
Till 10
Okay,
years,
10
really 10
years,
years
okay.
before you say it's cured.
Okay.
That's kind of what I needed to know, so
Thank
that
you,
I can
yeah,
speak
yeah.
intelligently about when people ask, because I've been getting bombarded by people who want to know what's going on with me, and I want to use the right vernacular and the
Right.
phraseology for it. So, remission,
About 10 years. Okay.
and we'll know in 10 years if I'm cured.
Right.
It's a slow, and I'm okay with it being a slow-moving cancer. That gives me a chance to catch it.
Yeah.
Okay. Did you have any more questions for me? Okay, well, Doctor, I appreciate all of your help and your patience and answering all of my questions. I had a lot of questions, probably. So.
Not anything unusual. Okay.
Thank
All
you
right.
so much, Dr.
Congratulations.
Jones.
Thank you.
Thank you so much.